Hey everyone, I'm Anastasia, America's Dental Hygienist, and your host for Curaprox video series. And today, I'm honored to have with me Dr. Malcmacher, who is a practicing general dentist out of Cleveland, Ohio, and he's also associated with AAFE. Welcome.
Welcome to you. Thank you so much for having me.
I appreciate you are all over the United States, so not only do you practice clinically, but you also educate us on facial aesthetics. You educate, with Botox. How did you find out about Curaprox? How did you discover it?
And that's a great question. And first of all, Anastasia, you do a great job with everything. I'm just trying to keep up with you. But we'll get to Curaprox. Curaprox really is it's wonderful. I mean, I've been overseas many times. I've had a number of friends that have introduced me to their products. Toothbrush is very unique, but especially the interdental cleaners, which in Europe is very widely regarded. Hygiene is incredibly important to everything I do as a practicing general dentist, whether it's dental aesthetics, implants, or facial aesthetics. It's important because if you don't keep it clean, then all of a sudden everything's falling apart, and I don't want to have to redo it. Certainly the patient doesn't want to have to redo it.
And I thank you for your kind comments. I'd always use Interdental, and we stress flossing, we stress the removal of plaque because we know about 45% maybe of the tooth surfaces are in between. What I found interesting is with the way that we fit the interdental brush with Curaprox, how we actually customize that for the patients. How did you integrate that into your practice?
You talk to people about flossing all the time, and really it's a joke because they just don't do it. Whether they hate it, whether it's hard to do, whatever it is, but they always pick their teeth, right? And they're always picking their teeth, and a lot of dentists I know are telling them, stop picking your teeth. Well, now you can tell them to pick their teeth with an interdental cleaner, because now it'll be as effective, if not more effective than floss, as you know some of the studies suggest. And you're right, these are very unique because they can be fitted specifically for the patient. So it gives the hygienist another way to kind of, have a conversation with a patient, show them that they're doing this just for them, customize something for the patient, as opposed to saying, just go home and floss. So the dentistry I put into their mouth, I want to last a long time.
There's more people who are getting dental implants, and yet we're seeing some infection or some inflammation in maintaining those. So it makes sense to have a brush or a bristle versus the string that we've all been taught. The probe and the color coding technique I found was very unique. So, has that been warmly received by your team and, say, by your patients?
You bet, and especially when it comes to implants, as you bring up. Years ago, when anybody gets started with implant therapy, and especially when you learn how to do the surgical implants and that part of your practice, you put them in and they're great. And for years, everybody thought, this is better than teeth because there won't be any perio or anything like that. Now, the biggest problem in implants is peri-implantitis, because guess what? They do react just like teeth if you don't keep the areas clean. You can speak to it better than I do because my hygienists are the ones that are going ahead and, like you said, customizing it for the patient. So I don't know what they're using. I'm just happy as a dental professional that they're saving the dentistry that I put into their mouth. And that's where we all work together, for the good of the patient.
You found something that was new and you integrated it into your practice. I, as a hygienist, like I said, I extend your vision, so I'm able to follow through with what you find. What are two things that you could lead off into that dental practices may not, to help them integrate the Curaprox system into their office?
So, and you'll probably laugh at this, but I really believe this, and this is what I teach, whether I'm teaching clinical, things or whether I'm teaching practice management things. Dentists that are listening to this, delegate this. A good hygienist will integrate it in no time at all, and let the hygienist teach the dental assistant. Here are the aftercare instructions when you put in a crown, when you put in 6 veneers, when you put in a few implants and finalize them. Delegate it. If you're a dentist, absolutely delegate it. And that's how to successfully get it into your practice really, really quickly. And the patients will absolutely love it.
And I just want to thank you for your time and sharing what you've discovered with us so we can all make a difference for someone's oral health and life. Thank you.
All right. Thank you, Anastasia. Thanks so much for having me.